And we know that like 95% of our serotonin, our happy hormone, is made in our gut, and 80% of our immune system is made in our gut. And so this is how the gut can affect the brain, and the brain can affect the gut, in that if we're stressed, we throw off our gut. And if like our gut is off, that can cause us to have anxiety and depression. But there's another link with the vagina and how it's interconnected with both the brain and the gut, which has been really fascinating for me to discover over the last couple of years.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. You've probably heard of Kegels, those exercises for the pelvic floor muscles. But did you know the name came from Dr. Kegel, a male gynecologist who talked about the benefits? However, he didn't invent them because physicians have actually been recommending these exercises since ancient Greek and Roman times. Why are they so important? Well, you'll find out all about this and much more in today's podcast. My guest is Dr. Betsy Greenleaf, who's been specializing in female pelvic medicine and reconstructive surgery for over 20 years. She was the first woman in the United States to become board certified in urogynecology. She is the owner of Greenleaf Health and Wellness, CEO of the Pelvic Floor Store, and is host of two podcasts, Some of Your Parts and Body, Mind, Spirit. Dr. Greenleaf is also a best-selling author and host of the Happy Vagina Summit that comes out June 9th through 12th of 2022. In this episode, we covered the gut-vagina connection. Yes, there is a connection there. And how to keep the vaginal microbiome balanced. She explains what that is and how that's related to how often we get things like urinary tract infections and yeast infections. And yes, she does talk about Kegels and how they can actually prevent urinary continence and uterine prolapse, two things we really want to avoid if possible. If this brings up questions for you, please submit them at thewomansdoctor.com. I hope you enjoy this episode of the Woman's Doctor podcast. Betsy, welcome to the Woman's Doctor podcast. It's so great to have you on.
Thank you, Dr. Trevor. I'm so excited to be here. I always love talking to you.
Yes, this is so great, especially since you're in my Hormones, Health and Harmony docu-series. So it's so great to connect with you again this time, on Zoom, but that's good too. It works.
Yeah, definitely.
All right. So first of all, I know you're a urogynecologist. So can you explain to people what that is?
It's funny. When I went into urogynecology, I came home and I said to my husband, like, I finished my training in obstetrics and gynecology. And I'm like, I'm going to do 2 more years and not get paid anything of training in urogynecology. And he was like, what? I thought I married a rich doctor. I'm like, yeah, no. And then my mom was like, urogynecology. She thought it was like fancy gynecology, like European, like Euro Disney. And I was like, no, it's Euro meaning urology, having to deal with the bladder and the urinary system, and gynecology having to do with the pelvic health. So it was a combination of both. So it's a specialty that actually started in the 1970s, and it's pretty rare. And there's only about 1,500 urogynecologists across the country. So there's not many of us, though it's a much needed specialty, especially since 50% of women will develop like incontinence or prolapse, like a drooping and dropping of their pelvic organs as we age. So, yeah.
Well, and that's certainly not a fun thing to happen. And we want to do our best to prevent that. So we'll talk about that today, about how to prevent that from happening. And hopefully you can give us some information too on if it does happen, what could be done about it. So but before we dive into that, I'd love for you to talk about the gut pelvic health connection. It's such a thing. People are so interested in gut health and the gut microbiome, but people oftentimes don't realize this connection and also with the brain.
Yeah. It's funny. I love to say that we're not alone. And I joke around. I'm like, and I don't mean like aliens. It means that like our body, we are covered like internally, externally with bazillions of bacteria and yeast. And that without them, we wouldn't be able to survive. And so you always laugh because I was that mom that was like running around with my kids with a hand cleaner. And I realized that probably, trying to kill bacteria on our bodies is probably not the answer because we need it for our functioning. And so a lot of people hear about the gut brain axis that's become very popular. And we know that like 95% of our serotonin, our happy hormone, is made in our gut. And 80% of our immune system is made in our gut. And so this is how the gut can affect the brain, and the brain can affect the gut, in that if we're stressed, we throw off our gut. And if like our gut is off, that can cause us to have anxiety and depression. But there's another link with the vagina and how it's interconnected with both the brain and the gut, which has been really fascinating for me to discover over the last couple of years. And I think the biggest thing comes that we have a microbiome in the vagina that's also very unique to the area that it's in, and that we have this balance of bacteria that's supposed to be there. And the biggest bacteria that we often talk about is, maybe people have heard of lactobacillus. A lot of people have heard of acidophilus. That's one of about 5 of the big healthy ones that are in the vagina. And lactobacillus lives there when the vagina is in a healthy pH balance, so the acid level is just right. And in return, this healthy bacteria actually feeds off of our dead cells. Now, it sounds kind of gross, but like when we're young and we're menstruating, our vaginal wall is constantly growing, and we slough off cells because we don't need them anymore, and we grow new ones. And so those sloughed off cells are actually the food source for our lactobacillus. And in return, the lactobacillus protects us by making the vagina very acidic. And also it produces hydrogen peroxide to chase away the bad guys, the yeast and the bad bacteria. Now, how is this connected to the gut? And becomes very circular with the gut and the brain, is that if we're eating inflammatory foods, and we're not getting enough like fermented foods, because let's face it, cavemen didn't have refrigerators, and we were probably eating a lot more bacteria in our food than we do nowadays. So if we're not eating healthy bacteria and fermented foods, we're not getting those healthy bacteria closer to the vagina, because as women, we have the rectum and the vagina is very close. No matter how clean you are, bacteria passes back and forth. So we want to have our guts filled with healthy bacteria so that we are constantly keeping the vagina healthy. On the same note, if we're eating a lot of inflammatory foods, now we develop leaky gut, where we get our gut wall becomes inflamed, and now it kind of separates, and now food particles and toxins from our environment can leak into our gut and into our system. That causes inflammation in the body. That can also lead to inflammation in the pelvis. That can lead to bladder inflammation. That can lead to vaginal inflammation. So if our gut's not healthy, the vagina is not going to be healthy. And then where we go when we connect this with the brain becomes even more fascinating for me. Is we already know that there's a connection between the brain and the gut when it comes to mood and anxiety and depression. Well, they're actually finding that if we have healthy bacteria in the vagina, we're more likely to have a great sex drive. We're more likely to be fertile, because the body senses that when things are off, so say things get thrown off from stress or from a bad diet, and now we lose our healthy bacteria in the vagina, the body's going to sense like, oh, you know what, now's not the time to be reproducing. And so it will actually dampen the hormones of the sex drive, number one, and will also prevent fertility. So it's amazing that the body knows when things are right and when it's not right without us actually consciously telling it. So, it's amazing that, the vagina microbiome could be controlling fertility and sex drive on top of just general health. So
Yeah, I think that a lot of times women don't realize how much that plays a role and our health of our pelvic area. And so, you mentioned a few things, but what are all the ways that an imbalance in these microorganisms can impact our health?
yeah, so I mean, the obvious is if it shows up in a pelvic symptom. Sometimes I tell people if you're getting recurrent pelvic symptoms, like let's say like recurrent vaginitis, so like itching, burning, discharge, or recurrent bladder infections, like burning when you pee, a lot of urgency and frequency, that can actually be your body screaming out for help, and it might not just be coming from the pelvis. And this is why sometimes when women get these problems, they may get treated for like a urinary tract infection, or they get treated for a vaginal infection, and they get better for a little time amount of time, but then all of a sudden they find it come back and it comes back and it comes back. And so some people get stuck in that because there may be a bigger problem going on with the body, like the gut. And that's why we often have to look into the gut. Or if you're living a really stressed life and you're like raising your cortisol and throwing off your gut because you're mentally stressed, and now you're also affecting your healing because you are stressing yourself out and raising your cortisol and you don't heal right. Those things can be also impacting the pelvic health. So it becomes this very circular thing, like how is this affected? And then the problem becomes a lot of the antibiotics that we use to treat urinary tract infections. Like, it drives me crazy as a urogynecologist. Like, now that I know better, like ciprofloxacin or Cipro, a lot of people have heard about it. That's like the number one drug that we use for urinary tract infections because it's a very broad spectrum antibiotic and it pretty much knocks out everything. But that's the problem, is that it knocks out everything. It can throw off your gut health for up to a year after one course of that antibiotic. So here we're trying to help people's bladders and we're really just throwing off their gut. So the idea is that we really need to be using antibiotics that are more specific to the infection that they have, and trying to not use these kind of like bombs to like kill everything and anything. So
Yeah. I mean, but yeah, say like when you have a urinary tract infection,
yes.
you want to treat it, right? You want
Yeah,
to get rid of it.
exactly. Exactly. I
It
think the
can,
key with that is like if you're going to be on any kind of antibiotics, really try to incorporate some sort of fermented foods or probiotics to really go out of your way to try to rebuild that gut microbiome after you've been on any kind of courses of antibiotics. So,
okay. And what
yeah.
about, is there any kind of like suppositories or anything that you can apply to change
Oh
the
my,
floor? Yeah.
I love this. I like you. I love this question. So, probably the biggest thing is the fact that the vagina is a very acidic environment. So, let's like look at pH for a minute. The pH of water is like 7. The pH of the vagina should be like 3.5 to like 4.5, which is very, very acidic. So, one of the easiest, most natural, and this is like old school, like women have been using this forever, is boric acid. I absolutely love boric acid for rebalancing the pH of the vagina, because sometimes that's one of the other problems is sometimes when you get an itch or a discharge, you don't know exactly what it is. And most women go automatically think it's yeast, when only about 12% of the time it's yeast.
Hmm.
The other 80% of the time, it's usually a bacterial infection. And so, yes, we have like all these wonderful, access to yeast medications over the counter, which has been great. I remember years ago when you used to have to like wait to get to the doctor and then get your prescription, and there was so a delay. I mean, now we can go and buy these things at any time. But a lot of times women go and they buy the yeast medication and they still don't feel any better because it's probably bacterial. So that's why I like boric acid, which you can now find in most pharmacies, most health food stores, like I think even like Target and Walmart carry them. Is that you can find boric acid suppositories, and that usually will balance out the pH of the vagina, whether it's yeast or bacteria. Now, of course, if things don't go away, maybe something more serious, you want to make sure that you don't have like an STD, sexually transmitted infection or a parasite. So if it still doesn't go away, you may have to make sure you get checked out. So you don't want to just kind of be like blanket statement, let's just go for these suppositories over the counter without it getting better. I would say try it once, and if it's still not getting better, then make sure you see a doctor to find out what's really going on.
So how
So
many days or a day or like how long?
yeah, I find, well, I would say that usually 5 to 7 days, and usually putting these suppositories in like once a day, usually usually at nighttime tends to work. So that's like my preference. Now, I do have a lot of patients, and even myself have had this issue that every time I have sex, I get a urinary tract infection. And that's because the it's so this one I haven't figured out why we're made this way, but we said the pH of the vagina is very acidic, but the pH of semen is very basic. So the pH of semen can be anywhere from 7 to 8. And so that can throw off the vagina. And so some people are really prone to recurrent urinary tract infections after they have any kind of sexual activity. So sometimes I'll have patients just pop in one boric acid suppository like right after any kind of sexual activity, just to kind of help rebalance things. And it's great. I mean, I, as a doctor, can say that we're using these things to kind of treat bacteria and yeast. However, you will see a lot of these things sold over the counter as treating odor. And so, because when it comes to like the FDA and these companies, they're not allowed to, basically put these products out saying they treat any conditions. But really, the reason why a lot of women have odor is because of the bacteria that's present. I mean, it's the same reason why like sweat doesn't have odor. It's sweat. The reason why when we sweat our underarms stink, it's because of the bacteria that's on our skin. The same thing with the vagina is that if you're noticing some kind of little thing that's off or a little funky, it's because of the bacteria that's present.
Really, really interesting. Thank you for sharing that because it's certainly something that all women struggle with at some point,
Yeah,
right?
yeah,
Whether we want to
exactly.
admit it or not, but it is.
Exactly.
So now what about the changes that happen as we get older and we have, especially when we have a decline in estrogen or, like there's certain times of our lives too, like after pregnancy or something when estrogen drops, what happens, with the pH and the microbiome with that?
Yeah, unfortunately, we see this very common in women who are menopausal. And you're right, right after pregnancy, when the hormone estrogen is low, and even women on birth control pills. So, all those states, we have a very low estrogen level. And really, the vaginal tissue responds the greatest to estrogen. That's what keeps it nice and thick and healthy. So, unfortunately, the vaginal tissue will start to thin out. This is where women will start complaining of vaginal dryness. They may get pain with intercourse. And the worst thing is we're basically starving our lactobacillus to death, because what happened is we don't get that turnover of cells and that sloughing off of the old cells because of the new active growth of new cells behind it. So what ends up happening is the lactobacillus loses its food source and we start to lose it. And then what ends up happening is the pH of the vagina starts to shift and it becomes more basic. And then this is where we end up starting to invite other bacteria in that start taking over. And so this is the number one reason why women who are pregnant or breastfeeding or on birth control or postmenopausal women are much higher risk of vaginal infections and recurrent urinary tract infections. So sometimes, I mean, in postmenopausal women, it becomes a lot easier. We do things to try to rebuild up that tissue, whether it's vaginal hormones or even laser regenerative therapies can really help. When you're pregnant and breastfeeding, unfortunately, you kind of have to kind of just deal with it a little bit. But women who are on birth control, this may be something that they need to treat additionally to get a little more either estrogen in the vagina, or even they can use laser treatments to regenerate the tissue. But it does unfortunately put us at a much higher risk of these conditions.
Yeah,
So
yeah. Well, and they're, doing things like to support your gut health and, taking probably oral probiotics and things like that might be able to help to some extent, right?
yeah, and you know what the nice thing now is you can go and find women's probiotics. So, I mean, I love fermented foods. I'd rather people get it in that way, but with the types of lactobacillus that we're looking for, there's a lot of actual, pretty much any health food store you can find ones are specifically made for women, because the ones that we look for are lactobacillus acidophilus, and these are going to be starting to become a mouthful, but lactobacillus crispidus is probably one of the healthiest ones that you can find. There's a couple companies that make lactobacillus crispidus vaginal suppositories too, so you can kind of repopulate the vagina. Lactobacillus reuteri, lactobacillus rhamnosus, and lactobacillus gasseri. So I know that's like a whole mouthful, but they found that in studies that taking these probiotics, that it can take anywhere from a week to a month to repopulate the vagina after taking these things orally. So,
Yeah,
yeah.
absolutely. Okay, so now as promised, we're going to talk about a little bit about urinary incontinence and prolapse and things like that. Preventing. Let's talk first about how to hopefully we can, I mean, because the sooner earlier we start with certain things, the better, right?
Yeah.
And then we can talk about too about once people are already having those issues, what can be done about it.
Yeah, well, one of the biggest problems is starting in our 30s, we start to lose muscle mass. Unfortunately, that's all of us, no matter what we do. But we tend to think about exercising our body. We don't think about exercising the pelvic floor and the vagina. But this is where it becomes really important, because doing Kegel exercises and starting young and continuing to do them is going to really help support the pelvic floor, because all of a sudden waiting until you have symptoms down the road, it's a lot harder to reverse, because we can end up really with severe muscle atrophy where you can't even tighten those muscles. So it's something you want to keep it up and keep doing. Now the muscles are just going to help support the pelvic floor. They're going to kind of take, they can help with incontinence, they can help with the appearance of prolapse. But a lot of times with incontinence, leaking of urine, especially when it's from coughing, laughing, sneezing, that's called stress incontinence. Or let's say a prolapse, and a prolapse is where all of a sudden the pelvic organs kind of start to droop and drop, like the uterus can kind of drop, or the bladder, or the rectum, and it just kind of, they all lean on the vagina and kind of push it out. That's typically from ligaments that have been injured, and most of the time it's from childbirth. And so there's not a whole lot that we can do about that, because some of it is genetic. Some of us are more prone to ligament injuries than others. um Biggest things that you can do to prevent that and make our ligaments stronger is good nutrition and not smoking. Smoking has definitely been associated with a higher risk of incontinence and prolapse. Because it does weaken the collagen that makes up our ligaments. But unfortunately, once those ligaments are torn during pregnancy or childbirth, or if I've seen it in women who've lifted heavy objects, or have really strained with severe constipation, or have had a really bad coughing spell. Once those ligaments are torn, there's not a lot that we can do. But at the same time, having done surgery for 15 years out of my career, I came to a point where I realized, you know what, just because things don't look the way they're supposed to doesn't mean you have to have surgery. And so, a lot of times you go to a surgeon, they're going to tell you you need surgery. But I realized that if it's not affecting your quality of life, then you put it off, because we have found over these years, especially a lot of people have heard about vaginal mesh. That was kind of touted in the early 2000s as going to be the cure all. And then we found that there were some problems with that material, and some women had some, really suffered with that. We kind of realized that um, these surgeries also aren't permanent. So it's not like, if you had your appendix taken out, you typically don't have an appendix again. But when you have a prolapse fix or incontinence fix, usually, I mean, if you can get 10 years out of it, if you get a lifetime out of it, we love it. If you get 10 years out of it, we're really happy. But there's some women who it can still come back because, not because the surgeries have failed, but because some people just have a tendency for their tissue to be a little bit weaker. So even though you fix it, it could still kind of droop and drop. So,
Okay.
yeah.
All right. Well, I mean, the good news is there are surgeries, there are things we
Yes.
can do. There are pessary, you can do a pessary
Yeah, so pessaries are amazing. So pessaries are little support devices. They come in all different crazy shapes and sizes, and they basically fold up and insert in the vagina and kind of wedge in there and hold things up. I don't recommend this, but in ancient Egypt, women used to use pomegranates. So they'd put a pomegranate in their vagina. In Rome, they used to use potatoes and rocks. I do not advise that. We have these very nice medical devices that you can be fitted for at a doctor's office. Do not try to do your own version of these things, but
Oh,
it's been something that's existed forever. So
yeah, yeah, amazing. All right. Well, this has been fascinating and very helpful. Betsy, thank you so much for joining us today. Where can people learn more about you?
yeah, so you can follow me pretty much at any social media in some way or the other. Just look for Dr. Betsy Greenleaf, and you'll find me. Also, I have a summit coming up that we're going to be discussing all these kind of things called the Happy Vagina Rally. And so we'll be giving Dr. Trevor links to that. So you can go find that through wherever she posts her links. And I have a online store that we do we put a lot of posts on pelvic health, and it's called the pelvicfloorstore.com.
Right.
So yeah.
It's so nice that we have more answers than we used to. It used to be a lot harder to find this kind of information.
Yeah, and especially it's now that we're talking about it. So I think that's another great thing, is just opening up the conversation and talking about pelvic health, because I can't tell you how many times women have come into my office and they're like, I must be the only person that this is happening to. And you're not. It's so incredibly common. It's just, we need to share more about what's happening.
Yeah. Thank you so much, Betsy. And I can't wait to share your interview on the Hormones, Health, and Harmony docuseries.
I can't wait. Thank you so much.
Thank you for listening to the Woman's Doctor podcast. If you enjoyed the podcast, be sure to share it with the women in your life. And to learn all about balancing hormones, join us for the Hormones, Health, and Harmony docuseries at thewomansdoctor.com.